I am Dr. Waples, the founder and medical director of Restore Medical Spa, and today we are talking about PRP. Now this is part 2 of the PRP videos. This is going to dig a little bit more into the science, so if you want kind of a higher level overview of what PRP is, watch part 1 first before you get hit with this. So, PRP stands for platelet-rich plasma. It's a tool that we use to regenerate tissue. The way that we harvest it is we draw blood, we spin the blood in a centrifuge, take out the platelets and the stem cells, and apply those to the tissue we want to regenerate. Now, a common question that people have about PRP is, well, I've already got blood circulating through all of my skin, all over my face. Why in the world is putting more blood products on my face going to cause my skin to regenerate? That makes no sense. And it's a great question. And the reason is this. Your body has healing capacity. Your body has the capacity, the ability to regenerate any tissue it wants. That capacity is controlled largely by your platelets and your stem cells. Inside a platelet and inside stem cells, there's proteins called growth factors. These proteins, you can think of them as the traffic signals of the body. They tell cells grow, don't grow, or die. That's kind of the idea behind growth factors. And your body controls those very, very tightly. So when your platelets and your stem cells are circulating around in your blood, you can think of them like toolkits. I like to think of them like little tiny toolkits that have inside them all of the tools you need to tell whatever tissue in the body you need to regenerate, but they are locked, they're inactive, they're closed. When we take those cells out of the blood, we activate them and then we apply them to tissue, allows the tissue to regenerate. Now the next question is, well, how does it know what tissue it's in? How does it know what tissue it needs to grow? This is the most elegant thing about platelet-rich plasma. Every different tissue in your body has a different language. It will respond to a different family of proteins. So there are hundreds and hundreds of different growth factors inside every single platelet in your body, hundreds of different proteins that basically correspond to the language spoken by each different tissue type in your body. So for example, your bone has a certain family of growth factors that it will respond to, and none others. It won't see any of the others. Your muscle tissue has a certain family of growth factors they'll respond to, ignores all the rest. Your skin, same thing, has a certain family of growth factors they'll respond to, and nothing else. So when a platelet arrives in some damaged tissue, whether it's a bone or a muscle or skin or whatever it is, it breaks open, spills out all of its growth factors. The tissue that it's in sees just the growth factors that are specific to it, and then does whatever the body wants it to do. It's an incredibly elegant and flexible system, which explains why, if you take platelet-rich plasma, or PRP, you inject it into a knee, it'll grow you a new ACL. You inject it into a bone in the jaw, like if the dental surgeons do, it'll grow you new bone. If you apply it to skin, it'll grow you new collagen. It's an incredibly flexible, incredibly powerful tool. But the basic science behind it is that platelets have the ability to speak to any tissue type in the body, and once they are activated, once they are opened up and allow those growth factors to permeate the tissue they're in, they will speak only to that tissue, cause regeneration, and make your face just beautiful.